Hey everyone, welcome to Taking the Pulse, a healthcare and life sciences video podcast. I am Heather Hoops here in the studio today, joined first by Lauren DeMoss in Birmingham, Alabama. Lauren, Happy New Year. Great to be with you in 2024.
Yeah, thanks so much, Heather. Happy New Year. Great to be here today.
Thank you. And on today's episode, we're welcoming Johnathan Samples. Johnathan is an accomplished software developer and led the development of Greenway Medical Technologies' Prime Suite EHR platform, which is used by more than 50,000 providers. Johnathan is currently a partner at 121G, which engages with companies to provide capital investment and business advisory services, as well as help them develop technology assets. Johnathan, thank you for joining us today.
Oh, thank you guys for having me. I'm excited to talk about my favorite topic here, which is AI and healthcare.
Excellent. And doing so with the most beautiful background I think we've had to date on the Pulse. Speaking of background, not that one, give us a little bit about your personal background and your experience with healthcare companies and technology.
Yeah, absolutely. So I've been in the healthcare space for almost 25 years now. Started at, as you said, an electronic healthcare record space, building EHRs, practice management, billing systems, and clinical research systems. And after doing that for about 18 years, decided to do something a little different and went into the consulting and investment space. And during that time period, we've really had the opportunity to work with a lot of startups, and the birth of kind of what we were doing and the rise of AI kind of timed itself together really well. And so we've had a lot of fun and a lot of experience helping companies figure out how they navigate early artificial intelligence and how they apply it to their product lines and their solutions. And within probably the last 6 to 12 months, we've really seen a huge explosion with the chat GPTs and the bards of the world coming onto the market. So it's always fun because it's such a fast and evolving environment. Healthcare is just in general, but then when you throw AI in the mix, you end up with two rapidly changing things that can benefit each other, but also comes with some concerns and things that need to be thought through.
Yeah, Jonathan, I mean, AI is such a huge topic right now in healthcare, and so many people in the industry are kind of looking at how to implement it into their either technology systems or care delivery systems. There's just lots of different ways it can be used. Can you give us some specific examples of how you think providers and I guess maybe even patients really stand to benefit from the use of AI?
Yeah, I think there's a couple of natural use cases. One, if you just think about clinical research and clinical analytics, if you take a simple problem where we only have two input parameters, right? Like we have calories and the amount of exercise. It's pretty easy for a human to kind of extrapolate. Okay, as calories go up and exercise goes down, weight's going to increases, and we can see that relationship. But when you start thinking about the modern patient, they're wearing possibly a Fitbit that's counting steps. They've got their watches that are counting, measuring heart rate, O2 saturation. We've got, home devices that are taking blood pressure, doing O2 as well. We've got DNA with 23andMe. We've got our electronic health records, drug databases like SureScripts that keeps track of not only everything prescribed, but what was picked up. And then you've got huge access now to environmental data. What was the temperature on that day? What was the barometric pressure? And so you just think about the amount of data that we have on any single patient. It provides a tremendous amount of data to really do research on, and it's beyond the scope of what a human mind can really get a grasp around, and can differentiate between what's really causation versus just correlation. And so that's a natural place for us to look. It's a natural place for us to apply that. I think another huge opportunity is patient engagement. If you look at the market right now, in healthcare, there's a huge shortage of care providers, and it's just expected to grow over the next 10 years. And so there's increased number of patients, there's an increased number of patients aging, there's a shrinking number of providers, and we're even seeing reimbursement shrink, over time, which is just exacerbating the problem. But giving patients a place that they can go or an application that they can go to, they can answer some of these questions and some of the things that it's not diagnosis, it's not treatment, but it's asking things like, hey, as a diabetic, how do I manage my diet? What are things that I can eat? What are things that I could think about? How do I replace my going to McDonald's every day and have a healthy, diabetic approved diet? And so asking those type of questions and asking for menu generations, asking for, advice on exercising, those are things that a lot of times providers are spending their time on. And those are a lot of things that really we could engage our patients better by leveraging some of these, chat models that are out there and helping coach these patients.
Yeah, I guess it really facilitates what's known as kind of personalized medicine, personalized care. There's some efficiencies there to be gained, knowing all these different variables and how that might contribute to somebody's care plan after a diagnosis or managing a chronic disease.
Yeah, absolutely. Driving the conversation, whether it's education or care plan, with all the data that we talked about just in the opening, you can use all of that education to really drive the patient toward the right exercise plan, the right diet plan, the right medications, and really, we've always talked about personalized healthcare, but now we have enough information and the processing power to really personalize healthcare.
Right.
With anything new, there are always challenges, and then the other side to consider. Talk to us a little bit about some challenges that you might see with AI, whether that be with disparity or a lack of mistrust, or I don't even know, lack of training or misuse.
Yeah, I think if you look at like the large language models that are out there, like Bard and ChatGPT, there's a large number of those now. But if you think about them, they're really just a reflection of society. And so all of the biases that exist in the data that are, think about Facebook, YouTube, and all the open sources that are out there, all those biases and either bad opinions or wrong opinions, it's a reflection of open society. And so the question we really have to look at when we're talking about artificial intelligence is where is the data coming from? These systems are no better than the data that's fed into them. And so we've got to really ask questions about bias and about, is this an accurate prediction? You think about it, I was talking about earlier that we have vast amounts of DNA data that we can pump into clinical research. But if you think about the people who are going out buying 23andMe, you've already got a segment of society there where you're looking at people who can afford to buy the service and who can donate their DNA to that service, and you're missing a huge portion of the DNA. You're just not getting enough variety. You're not covering all of the people groups that you need to cover, and so we've got to be very questionable, and there needs to be a level of transparency on where did the data come from that drives the information that we're taking. You think about they're talking about taking a lot of these large language models and connecting them to memory systems such as a Q-star system, which basically means they're learning over time as they have conversations with people about, oh, let me improve my conversation. But what we really get down to, and the core problem that we're seeing in AI right now, is it's really a philosophical question: is how do I know what is true? And is it does the AI really, not how do I know, but how does the AI know what is true? Is it what I read on Reddit? Is it what I read on Wikipedia? Is it what I read in the medical journal? I've seen opinions different in different groups. I've had users tell me things. And so we have to start looking at how do we define systems and rules for these AI systems to really determine what is true and what are we going to base that on? And so that's a fundamental problem that we're seeing in these large language models that are out there, is, determining what is truth. I saw, outside of healthcare, I think it was last week, Michael Cohen had went out and did some research on his own case and cited articles in a U.S. district court that didn't exist, and cited case law there. And so, making sure that we know what's the source of the truth and where that truth comes from, I think, is a key problem in leveraging these AI platforms.
Is someone working on that? That sounds like a clear problem, but is anyone working on that?
Yeah, so there's groups. I think there's a lot of disparate groups doing that right now. I think Google's trying to answer some of those very same questions. I think OpenAI is trying to answer some of those questions. And I think you've got some people, we're starting to see some legislation, that people are looking at to try to get some transparency on that things, videos, or that text was created from an AI, and trying to put some labels on those things. I'd like to see something similar to a nutritional label that you see on food, right? When I get a produced paper, I'd like to know, okay, is this 100% human organic, or is this 50% AI generated? So I don't think anybody has the answer yet, but there's definitely industry groups that are looking at that and trying to answer that basic question.
Yeah, and as exciting as it is on the one hand, and you mentioned, Johnathan, there's the distrust or mistrust, with what am I getting? And then there's the obvious of the bias of the data, not knowing kind of where all it's coming from and how thorough it actually is. I guess in your work with providers and ones that are considering implementing some type of AI in the delivery of care and data analytics, what other kind of concerns are you hearing? Are there other things that give them pause or even more hesitation in terms of implementing, or is it kind of let's push through these concerns and implement anyway and see where it takes us?
Yeah, I think there's the first two large concerns that people always bring up is, how do I know this is accurate? And so being able to prove accuracy and prove your source data. I think the other big thing that people often ask is, where is my information going? I'm feeding a lot of information into these systems, but what's the end use of that information? Is it going back into training? Is it being resold to third parties? And so, a lot of people are very reluctant to even use some of these different AIs because they're not sure what where their data lands. And within healthcare, we're required to know where that data is going, how it's treated. It's encrypted in transit, it's encrypted in rest, and if you're pulling some of these open websites up, it's really hard to know that those things are taking place. The other thing that I see, just a human aspect of change, is there's always the question that, is this going to replace me? There's always that fear and there's always that question. And the thing that when we're building tools that help people is, we like to say, look, I'm not trying to replace you. I'm trying to help you do your job 25% easier. And so we're just trying to make people optimize how people spend their day, and really get people to operate at their highest level. We've always talked about this in the healthcare space. We want physicians, we want pharmacists, we want these guys to operate at their highest level. But a lot of times we see them being, doing data entry, looking up basic things. And so if we can take some of that data entry, if we can take some of that lookup and bring that information right to those healthcare providers, then we help them operate at that highest level. We're not replacing them. We're just helping them be the best that they can be and not spending their time on things that are really beneath them.
That makes sense. Now you mentioned too, and I won't bore our listeners with a big HIPAA kind of sidebar, but in terms of where the data is going, I know looking at kind of ability to de-identify data and how it'll be used. That's certainly something that folks are paying more and more attention to, in different agreements and arrangements with health technology companies.
Yeah, absolutely. I think the other thing that if there's people listening, that they need to be asking the question in their groups. They need to be educating their groups, because I promise you, if we're just ignoring it and not educating our teams on this, somebody in our teams are going to be using this, and they're probably using it incorrectly and making assumptions about how it works, where the data comes from, and whether they can rely on it 100%. Without educating the teams, it's really a great opportunity for something bad to happen and data to really get put in the wrong location and be used for things that it really shouldn't be used for.
Mm-hmm. It just is transforming so quickly that I feel like I learned something, and then a month later it has completely changed and has advanced even more. So I know that's got to be a huge challenge for legislators and providers as well. In addition to maybe that nutrition label that you mentioned, what else should they be thinking about to try to wrestle this all into a positive situation where we're actually leveraging the information for good, as you said, to make our time at work even more fruitful?
Yeah, I think there definitely has to be some. There's a couple of things we need to look at. We need to look at from an AI space, security. I think everybody's been so excited about AI, and it's been adopted very, very rapidly in the commercial space. So you think about personal use, and people are using things for homework and for writing letters and those type things. But when we start applying it to healthcare and start applying it to legal and things where we're starting to impact people's life, then we've got to start looking at basic security. Where is this information being shared? How is it being protected? We've seen in the last probably 6 months several instances where some of the large AI vendors have had break-ins where people were able to steal a lot of their technology or steal some of the data. And so, those are real concerns, and those are things that need to be addressed. And so from an AI industry, we need to put a heavy focus on protecting that data, putting security first and foremost, and putting privacy at really the top of what's important. I think they've focused very heavily on innovation, and now it's time as an industry, for the AI industry to kind of slow down for a moment and make sure that we have things in place like privacy protection and the security protections, which in the end term, will help drive them more business because people feel comfortable with it and understand where their data is going and how it's being used.
Those are big challenges, Lauren. I'm sure the lawyers are watching this, thinking about, wow, just the speed of transformation. And, hopefully, Johnathan, as you say, the industry, will govern itself and slow down, because I do see the value. I mean, it makes sense to leverage the technology. Just do it in the appropriate way. Any final thoughts for our viewers? Share with us.
Yeah, this has probably been, I tell my team all the time, this is one of the most exciting times to kind of be alive, because we're seeing a huge paradigm shift. We saw it. I think the last big change that kind of related to that was about the size of this was the birth of the smartphone. And so this is rapidly changing how all of us do business. It's changing, how we function day to day, and it's making our lives better. So it's something that we've got to embrace. We've got to educate ourselves. We can't just ignore it, because if we're not embracing it, we're not educating ourselves. Our competitors will be, and they're going to be, they're going to be operating at a 25-30% gain over how we do our daily job. So I would just encourage people to get engaged, to try to stay on top. It's tough to stay on top of it because it changes every day. Every time I get caught up on it, somebody comes in and tells me about a new thing that I've got to get caught up on again. So it's changing at such a rapid pace that even somebody that's in the industry and does it 24/7, it's still tough for me to stay up to speed. So we've got to embrace it. We've got to figure out how do we use it. And I think a smart thing to do is just sit down and say, how can these tools make my business better? Where can I leverage it? Where are the good, easy spots that are not very controversial, that are very safe? And let's leverage it in those really easy spots first. And then as the privacy concerns get addressed, as the data security areas get addressed, then we can look at moving into some of those more confidential areas.
Well, you summed it up well. That's a tall order, but I am optimistic about the future. So I agree with you. I think it is a revolutionary time. Johnathan, we need to have you back to talk about AI again and bring us up to speed, if nothing more. Behalf of Lauren and our whole team at Taking the Pulse, thank you for joining us today to discuss, I think, probably the hottest topic globally right now.
Yeah, absolutely. Thank you guys for having me, and we'll be glad to be back anytime.
All right. Thank you. For those of you listening today, we hope you learned a little bit more about AI, and stay tuned to Taking the Pulse, because we are going to have this as a continuing topic in our episode list, because we know it is changing and it impacts every single one of us. We thank you for joining us, and we look forward to seeing you next time right here on Taking the Pulse, a healthcare and life sciences video podcast.